If I asked this to any Joe Schmo on the road, they would say, how in any tangible way, shape or form is medicine an art? I mean, you don't go to A&E and look at your doctor and think of Leonardo da Vinci, do you? But whenever you're asked a question in a medical interview, you need to show depth of thought. Obviously, if they gave you a one-sided question like, do you like Hitler? You'd give a one-sided response. But usually you have to illustrate evaluative nature, depth of thought, and the fact that you can evaluate the pros and the cons. If you're a doctor, you memorize a certain number of facts about the human body, anatomy, physiology, pharmacology, pathology, all the ologies. And then you put it into practice through observation and experimentation. Either observation and experimentation that you've done, or observation and experimentation that someone else has done, and compiled it into a textbook that you then read and learn off. But there are artistic elements in medicine as well. What is an art? Art is a product of creative skill and imagination. When a plastic surgeon has to use his sculpting skills to perform a plastic surgery to a degree of competence, and he has to use fine, precise motor skills to ensure he doesn't make any mistake. When a general surgeon has to suture a wound effectively and precisely to ensure he doesn't leave any marks, creative skill and imagination both are being required. Any tangible way of communicating is an art, because you need to adapt communication to the person you're talking to, taking a patient history, breaking bad news. All of this is an art. Sometimes when you're articulating to a patient, the patient doesn't directly tell you what their issue is, but you have to read between the lines and deduce subtle cues, have the cognitive function to be able to deduce what their problem is, even though it's the subtle clues in what they're telling you in which their diagnoses lie, not the actual words that are coming out of their mouths. Hence, although superficially medicine may seem like a science, but it's the art of medicine that enables that science to be applied into clinical practice.